Good morning, Andy Ray. I am Mihiraa. Let's start the warm-up sessions. What are your thoughts about nurses going on strike?
I know there are many instances when nurses and other healthcare professionals choose to go on strike, but I'm not sure I agree with it. I know I'm just beginning my journey to becoming a nurse, but I want to become a nurse so I can care for patients. I feel like when nurses go on strike, it puts patients and other healthcare providers at risk.
Can you give me an example of a situation in nursing when you would need to implement critical thinking skills?
I think all aspects of nursing must require strong decision-making. One example of critical thinking I can think of is when a nurse checks vital signs on a patient whose condition seems to suddenly change. By doing this, the nurse can determine what actions to take next and will have data to give to the doctor when she reports the changes.
How do you establish rapport with people from different cultural backgrounds?
I think the first step in building rapport with any patient, especially patients from different backgrounds, is to be approachable. If I were assigned a patient from a different culture, I would approach them with a smile and a friendly attitude. I would speak in simple terms and avoid slang, as I know these are easily misunderstood. If the patient seems confused or anxious by my presence, I will try to find out if they have any family and include them in any conversations.
What do you think the main reason is for people choosing not to seek medical care?
Although I'm sure there are several reasons people may forego medical treatment, I believe one of the main reasons is the lack of healthcare coverage. Although there are programs that offer reduced-cost medical coverage, individuals with low or fixed incomes and unemployed people often cannot afford even reduced premiums.
What role do you think nurse practitioners can play in helping reduce health disparities?
I believe nurse practitioners can significantly reduce health disparities in underserved populations. Nurse practitioners can provide almost every service a physician provides, but their services cost less, making the prospect of getting quality care seem more achievable.
You can now start your OET roleplay.
Thank you, Mihiraa, for letting me take a look at your wrist. This will help me get a better understanding of the rash. Now, it would be great if you could tell me when this started.
Sure, it started about a week ago. It's a bit itchy, but not too painful. I haven't tried any treatments yet.
I see. Besides the itching, do you have any other symptoms? For example, fever, nausea, fatigue, or any known allergies?
No, I don't have any other symptoms. Just this rash.
Thank you for the information, Mihiraa. I've taken a close look at the area on your wrist. The rash appears red and slightly raised, with a bumpy texture, and it seems to be confined to just your wrist. It's good that you brought this to our attention. The next steps will involve scheduling an appointment with the doctor for a more detailed examination. We might need to perform a swab test to get a better understanding of what's causing the rash. Don't worry, the swab test is quick and painless. This will help us determine the best course of treatment for you. We're here to make sure you get the care you need, and we'll do our best to make this process as smooth and comfortable as possible for you.
That sounds good. What can I do in the meantime?
I'm glad you asked. While we wait for your doctor's appointment, you can take a few steps to manage the rash and reduce any discomfort. Applying an over-the-counter lotion can help soothe the irritation. A cold compress can also be beneficial if it gets itchy. If you feel any discomfort or mild pain, taking paracetamol should help. Mihiraa, I want to reassure you that this rash seems relatively small and is often easily treatable. It doesn't look serious, but it's good to be cautious and get it checked out properly. Do you have any other questions or concerns about the rash or the upcoming appointment? I'm here to help.
No, that sounds clear. Thank you.
Great. Mihiraa, while the rash doesn't seem serious right now, it's important to stay cautious. If you notice the rash spreading beyond your wrist, developing any new symptoms like increased pain or swelling, or if it starts to ooze, please let us know right away. Also, if you experience any new symptoms such as fever or fatigue, or if the itching and irritation worsen, it's crucial to seek medical attention immediately. We want to ensure this doesn't develop into something more serious. Your health and well-being are our top priorities, so please keep a close eye on the rash and keep us informed of any changes.
Thank you for explaining that. I understand the importance of keeping an eye on it. I'll make sure to monitor the rash closely and let you know if anything changes or if I notice any new symptoms.
Perfect. Now, Mihiraa, can I have your consent to schedule your appointment?
Sure, you may please.
Mihiraa, let me summarize what we have discussed so far. During our conversation, we discussed the rash on your wrist, which you mentioned started about a week ago. The rash is red, slightly raised with a bumpy texture, and confined to your wrist. You've experienced some itching but no pain or other symptoms like fever, nausea, or fatigue. I reassured you that the rash seems relatively small and often easily treatable, but it's good to get it checked out properly. We talked about scheduling an appointment with the doctor for a more detailed examination and possibly a quick, painless swab test to understand the cause better. In the meantime, I recommended using an over-the-counter lotion, a cold compress, and paracetamol if needed to manage the discomfort. Mihiraa, I then stressed the importance of staying cautious and monitoring for any signs of spreading increased pain or new symptoms like fever or fatigue. You agreed to keep an eye on it and informed me that you would notify us of any changes. Finally, you consented to scheduling the doctor's appointment to ensure your health and well-being.